Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about a Lisfranc injury. It's a type of foot injury or foot sprain that is actually very, very valuable to understand. So if you look at the foot here, you get the toes up here, then you got the metatarsals, and then you've got cuneiform here. There's a ligament that attaches the cuneiform to the second metatarsal. In some situations, you'll get where you're running or walking or whatever, the foot flattens out, and you get a dislocation in the Lisfranc joint, which is the joint between the mediocuneiform and the second metatarsal, and you end up tearing that ligament. The disadvantage of that type of injury is it's notorious for not healing. As with other sprains, you get the ligament stretched out, it doesn't do what it's supposed to, and you continue to dislocate that portion of the foot. So you're spraining the foot constantly, and you're constantly having foot pain and injury in that area. So you'll say, okay, it improves over a period of time, and then you start doing something very simple and it starts to hurt again. So you keep re-injuring it. How is it diagnosed? Number one is symptoms. You will have pain right in that area of the foot. In fact, you can push on it and get pretty good discomfort. You can also take the foot and you can actually rotate it to evert it or invert it. Usually with eversion, you will actually dislocate and it will be uncomfortable and you'll actually feel it. The other is to do an x-ray. As you do an x-ray, you can actually look at position of the metatarsals, if they're lined up like they're supposed to with the other tarsal bones here, or if they're slightly dislocated. Sometimes they can be significantly dislocated and it's relatively easy to do. In some injuries with the Lisfranc joints, you can actually get a fracture. Those are typically treated differently, will require a type of surgery where you have to repair the fracture as well. A lot of times with this, though, conservative treatments don't work. Putting you in a boot or putting you in a splint or something like that doesn't usually fix this problem. A lot of times you will end up down the road having to do some form of surgery. So, recommendation, most of the time if you have a Lisfranc injury and it just barely happens, sometimes we'll put you in a boot if it's back in position like it should be to give you time for it to recover. A lot of times, however, we will progress you to surgery. There are multiple different surgeries that can be done. Typically, the way that we will fix this is we use a type of surgery that you run a wire between this bone and the second metatarsal that has buttons on either side that holds it back together. So what it does is it functions like a ligament, but it doesn't let you dislocate. Similar to the high ankle sprain that we talked about before, same type of thing. It's trying to keep it from dislocating, but still allows it to do the motion it needs to normal function or normally walk. So, Lisfranc injury, it's common, especially in athletes. It is pretty problematic, pretty sore, and can actually limit your ability to continue to walk and function, and especially participate in activities. It is the injury that a lot of times you will hear football players do that kind of end their season. Because of that type of injury, they have to do a repair, and most of the time it takes a while to get back to normal. This is Dr. Brandt Gibson, and this is your podiatry tip, day number 25. I couldn't remember, sorry about that. Day number 25, Lisfranc injury, which is the sprain of the foot. And tomorrow we will start talking about some of the other fractures that can happen in the foot that are also important.